This is the standing supported posterior capsule stretch from Postural Restoration Institute. The purpose of this is to get us to shift into our hip a lot more effectively. So what we're going to do here is set up with some sort of table object which is around waist height, and we have a book or something that's about 1 to 2 inches thick underneath our left side, our left foot. Now the book needs to be long enough that the whole foot can be flat. Now what we're going to do is, with our feet parallel and hip width apart, is we're going to place our hands on this table, or in this case the plow box, and I want Trevor to round his back and tuck his hips. Good, just like that. Now he's going to shift his left hip back. So he needs to do that by pushing his right knee forward and pushing his hips back and off to the side on the left, and he's going to push his left knee slightly in. Now his feet are in the same place, but he should feel his left inner thigh engage. And he's going to feel most of his weight on this left heel here, but his whole foot is flat. On the right side, he has about 30-ish% of his weight, and it's just kind of hanging out there with the right knee going forward, feeling that right foot arch. Now, what I want you to do, Trevor, is keep your back rounded, keep to the left on that left heel, and exhale and squat down maybe 20 to 30 degrees. And once he gets to that position where he feels like he might start to lose it, again, just 20, 30 degrees, he's just going to hold that position. And he's going to breathe in through his nose, out through his mouth. Now, as he breathes out through his mouth, he's going to feel these left side abs engage. I want him to hold those left side abs as he inhales through his nose. And then he should really feel his right side open up. So in this bottom position, you know you're doing it right if you feel your left inner thigh, your left heel, whole foot flat, maybe some left outside hip, and for some people, they're going to feel a big posterior capsule stretch on this left side in their left back pocket. The most common mistake in this activity is that people will not get their hip to the left enough. So we want this hip right here slightly outside this knee right here. So he should be able to do that without losing his whole foot flat on the left. And also, we want to make sure we're slightly side bent to the left, just a little bit. And then, in addition to that, people will start to lose it as they go down. So as they go down, they'll start to actually shift more right like that. We need to make sure we're shifting left still as we go down, pushing our left knee in as we go down, which is ultimately just going to keep the left knee in line with the left big toe. A big common mistake in this is, because there is a lot to think about, they're going to start arching their back more. So make sure you have flexion throughout that back. Make sure you have tucking. So this is what we're looking for, a nice smooth curve all through here. A progression to this activity after you can hold that bottom position and feel all the right things for a good 5 breaths, what we can do now is make it more dynamic. So everything still applies here. But once we squat down to that 20 to 30 degrees, keeping our back rounded, all that good stuff, we're going to now come up, pushing through our left foot, making sure we're keeping that flexion of our back, and then going back down. You can make it dynamic, go really slow, about 3 to 5 seconds down and 3 to 5 seconds up. Again, just make sure you're keeping all those same muscles on and maintaining the same position.